We are not going to be a state where it's okay, where we think it's a rite of passage to drink. We're going to be a state that says underage drinking is not okay, and we want to do everything we can to prevent it. The partnership between the Department of Mental Health and Substance Abuse Services and the State Department of Education targeting the significant problem we have in the state of Oklahoma of underage drinking is really going to be exciting. We are actually ranked 7th in the nation for the number of youth that we have drinking who are underage. When you look at those statistics, what we know is by the time someone completes 12th grade, over 70% of our students have used alcohol. And in fact, about 40% say they've used alcohol within the last 30 days. So what does that mean to Oklahoma? What we know is that youth who drink before the age of 15 are 5 times more likely to be dependent as adults than youth who wait till 21. So by looking at a prevention program like AlcoholEDU, we can avert a lifetime of consequences.
We think it's very important that we focus on this and let them know that there is an opportunity for adolescents to be able to take advantage of this program. We think it's important for parents and educators to think about the fact that kids are going to be getting out there, going to spring break, going to proms, and in graduation. You know, also in contrast for those young individuals that abstain from alcohol, nationally they're showing improvement in test scores, 18 points for reading and 45 points for mathematics. A young person that has just consumed alcohol will remember 10% less. So this directly affects their education as well as the quality of their life later on.
Yeah, I started this when I was a student in college, actually, and like a lot of young adults, looked around at an issue that, quite frankly, was you know, limiting the potential of a lot of my peers. And so a lot of us come to the obvious conclusion that alcohol can do things like, you know, affect your health and get you into trouble with authorities, and, you know, obviously there's the tragic consequences of drunk driving fatalities. But I think what really started to resonate was the fact that it was impairing performance in academic setting, etc. And so what we try to do with AlcoholEDU is empower young people to make their own decisions, right? So tapping into their own motivational currents about why they may want to abstain from alcohol longer. There's an awful lot of science behind that. There's an awful lot of reasons why they should do that. And we find that if we spend time kind of building that self-efficacy around it, that it's an incredibly effective path for them. You know, not only helps them make better decisions about whether they choose to drink or not, but across a whole host of other decisions they're going to be faced with throughout their lifetime.
We can decrease the cost that we're seeing to our state. In fact, in 2010, it was estimated that $831 million was spent as a result of underage drinking. That's as a result of car accidents, unintended pregnancies, dropping out of school, all those things we don't want to see for our state. We can really target that with this partnership of preventing underage drinking. The exciting part about AlcoholEDU, first, is that it's free. We've been able, through a federal grant, to make sure that this is available to all 9th through 12th grade students in the state of Oklahoma. And it's going to be promoted through Superintendent Barisi to the superintendents and the principals of those schools. It's an online course, about a 2-hour online course that's on the National Registry for Evidence-Based Practices, meaning there is clear outcome data that says this works as a prevention program. In that 2-hour course, there's things for students. There's also an additional component that looks for parents and for teachers to be able to really educate and create a culture where underage drinking is not what our youth are going to be doing.